In the name of God, today I want to talk about the fetal period. As you know, we divided the whole of the pregnancy into three phases. The second and the third phase is named is the embryonic period and fetal period. As I told you, the embryonic period, a recognizable human appearance and primordial of all major system has formed. But the period from the beginning of the ninth week to birth is known as the fetal period. Is characterized by maturation of tissue and organs and rapid growth of the body. As you see here, in these times we have a rapid body growth, differentiation of tissue, organ and system, relative slow down in the growth of the head compared with the rest of the body, and the rate of the body growth very rapid, and fetal weight gaining phenomenon during the terminal weeks. And in this time, it means that in a fetal period, if something is happened, maybe the embryo is aborted, or finally the weight of the embryo, if the weight of the full-term baby is less than 500 grams at birth, do not usually survive, and we say that immature infant. Maybe we have some abnormality like IUGR. I will tell you about this abnormality. And sometimes maybe the embryo, sometimes maybe embryo less than normal weight, around the 750 or 1500 grams. We say that preterm infants. And the prematurity is one of the most common cause of morbidity and prenatal death. But during the fetal period, we have some point about the measurement of the embryo. In general, the length of the pregnancy is considered to 280 days or 40 weeks after the onset of the last normal menstrual period, or more accurately 266 days or 38 weeks after the fertilization. During the pregnancy, we have many changes, and these times we maybe we use some thumb technique for the measurement and determine of the age of the embryo. One of them is a crown ramp length. As you see here, this is a crown ramp length, the measurement between the vertex at top of the head and the buttock. And another characteristic and another important things for the measurement is fetal height measurement, femurs length, gestational age, and something like this one. And that we divided the pregnancy to 3 semesters. The first semester, all major systems are developed. In the second semester, good anatomical detail can be visualized during ultrasonography. Most major birth defects can be detected using high resolution real-time ultrasonography. And in the third semester, the fetus may survive if born prematurely, about the weight about the 2,500 grams. Crown ramp length, as I told you, the method of choice until the end of the first semester. But after the first semester, usually clinicians, it means in the second and third semester, the clinician use ultrasonography, and this technique, they measure the biparietal diameters. It means that diameter of head between two parietal eminence, head circumference, abdominal circumference, femur length, foot length, and weights. This is the most important things that measured by ultrasonography after the end of the first semesters. Now I talk about the growth of embryo month by month or week by week. Okay, during the third month, the face become more human looking. The eye initially directly laterally move to ventral aspect of the face, and ears come to lie close to their definitive position at side of the head. And these times the head consists approximately half of the crown wrap length of the fetus. Gross body length accelerated rapidly so that by the end of the 12 weeks, the CRL crown ramp length has more than doubled. Urine formation begins. Fetal waste products are transferred to the maternal circulation by passing across the placenta. And another important thing, intestinal coil are clearly visible in the proximal end of umbilical cord till the middle of the 10th weeks. Because I will tell you, during the 6 to 10 or maximum 12 week, we have a one physiological herniation through the future umbilical region. We say that physiological intestinal herniation, and in this time if you're doing a sonography you can see that intestinal coil out of the abdomen, approximately in here you can see by arrow here in the fetus. And these times you can see that gradually the air go up because the first of all the air is situated in the lower position, normal position. The eyelids fused, and short legs and relatively small height, and liver major site of erythropoiesis. The external genitals similar until the end of the 9th weeks. It means that you cannot detected the sex determination in the 3rd months. Another important thing in the 3rd month is a primary ossification centers appear in the skeleton, spatially in the cranium and the long bones. And the upper limb have almost reached the final relative lengths, but the lower limb are still not so well developed and are slightly shorter than the final relative lengths because the limb bud formation take place later than upper limb buds. And finally, mature fetal form external genitalia is not established until the 12 weeks. Here you can see that the how the embryo grow from the 12 weeks to the 38 weeks. And look at the size of the head relative to the whole of the crown heel length. Here is a crown heel, the measurement of the vertex, the top of head, till to the heel. We say that crown heel length, and you can see that the size of the head or length of the head is approximately 1/4 of the crown heel length. And again, the head region, you can see here the head, the size of head in the superior part, as I told you, is the largest part of the body. This time is a head. And when you go to the next week, during the 4th and 5th week, the fetus lengths rapidly, and at the end of the first half of the intrauterine life is crown ramp length is approximately 15 centimeters, about half of the total length of the newborn. The weight of fetus increased little during this period, and by the end of the 5th week, still less than 500 grams. The fetus is covered by fine hair. That name is lonago. There's some fine hair, and eyebrow and head hair are also visible. During the 5th week, the most important event is movement of the fetus can be felt by the mothers. This is the most important things. As I told you, the lanugo, the fine hair, covered the whole of the embryo. The brown fat started to forming. The first of all started from the root of the neck, posterior to the sternum and preanal area. And if the embryo is a male, the testes have begun to descend, but they are still located on the posterior abdominal wall, as are the ovarian female fetus. And the 6th month, during the second half of the intrauterine life, weight increased considerably, particularly during the last 2.5 months, when 50% of full term's weight, approximately 3,200 grams, is added. During the 6th month, the skin of fetus is reddish and has wrinkle appearance because of the lack of underlying connective tissue. A fetus born early in the 6th month has great difficulty surviving, although several organ systems are able to function. The respiratory system and the central nervous system have not differentiated sufficiently, and coordination between the two systems is not yet well established. Because in this time, the secretion of the surfactants gradually is started, and fingernail in this time are present by 24 weeks. Here you can see that the embryo around the this image is around the 20 weeks of the gestation of developments, and 26 weeks and the 28 weeks of gestations. As I told you, you can see that the lunago and the hair regions. And in the 30 to 33 weeks, papillary reflex is established. The skin is pink and smooth. The upper and lower limbs have chubby appearance. The quantity of white fat is approximately about 8% of the body weight. 22 weeks and older usually survive if born prematurely. This is a picture that shows that the papillary reflex, spontaneous orientation to the light. By the 36th week, the circumference of the head and abdomen is approximately equal. The embryo at 34 weeks, and that one is the 38, the full-term embryo in the 38 weeks or 40 weeks gestational age. But finally, in the full term, the CRL about the 360 millimeters. This is a full-term embryo that you see the weight of the embryo in the full term. The weight is around 3,000 to 3,400 grams. CRL, as I told you, about the 36 centimeters. and crown heel length is about 50 centimeters. Sexual characteristics are pronounced and the testis should be in the scrotum in male uh, embryo. But in the premature male infants commonly have undescended testes. In this picture show that the low birth weight, this is one abnormality sometimes happen. We say that low birth weight, and in the low birth weight we have some things, some abnormality, but as you see in this picture, if the fetus deliver or deliveries happen before the full terms, maybe the embryo has a low birth weight. As you remember, the normal weight in the time of the full term embryo is around 3,000 grams or 3,400 grams. But if the embryo has around 2,500 grams or less, we say that a small gestational age. And in this case, we have an intrauterine growth retardation. And this picture shows that the week of the fertilization, this is a full term 38 weeks, full term embryo. This is a average normal, the weights, the average normal around between the 3,000 and 3,500 grams. This is the average weights. And in the smoker mothers, you can see that the weight of embryo is less than the normals, poor mature nutritions, and twins. You compare the weight of the embryo between these populations. If the embryo has a intrauterine growth retardation, we have a placenta insufficiency, preeclampsia is a kind of, it causes the hypertension in the mothers, multiple gestations, infection, disease, cardiovascular anomaly, maternal and fetal hormones, maternal vascular disease, intrauterine infection, cigarette smoking, consumption of alcohol, maternal malnutrition, and teratogens. It means that in these cases, if the mother has this disease, maybe we have an intrauterine growth retardation in the embryo. This is the most common reason for the intrauterine growth retardations. Here you can see that the expected date of the delivery of fetus in 266 days or 38 weeks after fertilizations. We say that 280 days or 40 weeks after the last menopause periods. You can see here the day, the weeks, the calendar months, and another detail by these tables. We have another term, post-maturity syndrome, the prolongation of the pregnancy for 3 or more weeks beyond the expected date of delivery. As a result, this fetus has a dry, parchment-like skin, overweight, no lanugo, decrease or absence of vernix caseosa, long nail, increased alternation. What is the vernix caseosa? In the full-term embryo, you can see that it means that by end of intrauterine life, the skin is covered by a whitish fatty substance that name is vernix caseosa, composed of secretory products from the sebaceous glands. We say that this is a vernix caseosa. In post-maturity syndrome, we don't have a vernix caseosa. The factors influencing fetal growth, the maternal, fetal, and environment, and the cigarette smoking, we have a low birth weight in the maternal smoking, and in this fetus, we have a 200 gram less than normal, prenatal morbidity is increased, the effect of maternal smoker is greater on fetus whose mothers also receive an adequate nutrition. Multiple pregnancy, weight considerably less, the total metabolic requirements of 2 or more fetus exceed the nutrition supply available from placenta during the 3rd weeks. The alcohol, I will talk about the alcohol syndrome in next lectures. And again, in the placenta formation, I talk about something and some genetics factor and growth retardation, structural and numerical chromosomal aberrations, Down syndrome, trisomy 18 syndrome. All of this situation causes the fetus weights. And now this lecture is finished. In the next lecture, I will talk about the placenta and twin pregnancy.